Good day, everyone. My name is Dr. Daniel Osigby, and I've come to talk to you today about type 2 diabetes mellitus. Hopefully, many of us are aware there are two types of diabetes: type 1 diabetes, which typically tends to occur in younger people, and then type 2 diabetes, which historically tends to occur in middle-aged and older adults. Um, the way they develop is very different, and we're referring in particular to type 2 diabetes because this is what we're going to be offering advice on. In terms of the definitions, some people define diabetes slightly differently, but these are the traditional definition of diabetes. So what is type 2 diabetes? So I'm just going to maximize my screen here. So type 2 diabetes is basically, like I mentioned, it's a condition in which people are not able to control their sugar levels in their blood. This can be due to the body becoming resistant to insulin or the body not making enough insulin. In people with diabetes, insulin secretion controls glucose levels. However, either the response to insulin or the secretion of insulin is not enough to ensure glucose levels are at the right amount. As diabetes progress, here in the UK, we measure this using the HbA1. We measure the level of sugar using the HbA1c, which looks like your sugar control over the last 3 months. We can also check if someone is diabetic using a fasting glucose or postprandial glucose. This is a glucose reading done 2 hours after somebody has had a glucose meal. So as diabetes progresses, the risk of blood vessel disease increases and patients also gain weight. The rate of type 2 diabetes is much higher in Africans and Asians as well in comparison to white people. What are the symptoms of diabetes? So how do you know if you've got diabetes? Typically, people can present with symptoms of feeling thirsty all the time, passing urine a lot, especially at night time. So usually I say to people, if you're finding that you're waking from sleep to pass urine more than once, then it's probably best you go and see your doctor. Tiredness, weight loss, blurred vision, genital itching, slow wound healing, these are all symptoms. People don't necessarily have all of the symptoms, and sometimes there's an absence of symptoms in some people who have type 2 diabetes, and they might be diagnosed on a random blood test. Risk factors and treatment. So we've just mentioned that basically ethnicity is a big risk factor. We know that Africans and South Asians have higher risk factor. And so taking that into context is all the more reason we need to protect ourselves from getting to type 2 diabetes. 2, if we do get it, reducing the risk and possibly reversing diabetes. Other risk factors include age, family history, being overweight. The fatter you are, the more risk you have of having diabetes. High blood pressure, people who have high blood pressure have a higher risk of developing diabetes. Also, if you've had gestational diabetes, so that's women who develop diabetes while they were pregnant and immediately this disappears, they have a higher risk of developing diabetes in future. People with severe mental health problems, this can be due to a number of factors. For example, some of the medications that we treat them with can put them at increased risk of developing diabetes. Smoking also increases your risk of diabetes. There is no such thing as mild diabetes or a touch of diabetes. And I say this because once someone has diabetes, it increases what we call your cardiovascular risk. That's your risk of having a stroke or having a heart attack. Treatment begins with lifestyle changes. So exercise, diet, weight loss, and the use of hypoglycemic drugs, which are basically drugs that lower your glucose levels, and insulin. Improving your glucose control reduces the risk of complications. And the complications are very important to know about because it's important to avoid them. It's not just about death with diabetes. It's not just the fact that you might have a stroke that will kill you or a heart attack that will kill you. It's actually the fact that the complications of diabetes results in reduced quality of life. So, and we know also that the degree of stroke can vary from actually just having an impairment that actually stopped you from being able to do things for yourself to having something such as blindness or disease of the eye. And just imagine becoming blind from diabetes and you've got X amount of time left in your life, and you will struggle, especially if you're not in a place where there are provisions made to help you to look after yourself. Also heart disease, erectile dysfunction, neuropathy, diabetic foot disease, and also diseases of the blood vessels, and what we call peripheral vascular disease. This is not an exhaustive list, but this is just to show the point that not controlling diabetes, having uncontrolled diabetes increases your risk of complications, and which not only make you more likely to die from the complications, but also potentially reduces the quality of your life. So this point, I do not apologize for repeating it. It's so important. The management of diabetes, it's about diet. So that's basically looking at what we eat. We eat lots of starchy food, lots of heavy food. We tend to use lots of salt and oils. So basically looking at things like reducing oils and reducing our portion sizes, like for example, the size of our carbohydrates, the size of whether it's a swallow or gari or whatever you're eating, it shouldn't be bigger than the size of your fist. And also eating more fruits and vegetables, more fiber, things like beans and vegetables, exercising regularly. I advise patients that they need to exercise about 150 minutes of moderate exercise a week or the equivalent. So 150 minutes might look like basically doing 30 minutes of exercise that make you sweat or double your heart rate 5 times a week and for 30 minutes duration. Lifestyle, so we don't want to spend all the time sitting down. We want to be active. We want to have a lifestyle that involves us moving around, and that means we're using more energy and hopefully helping to keep our sugar levels at a lower level. If that doesn't control our sugar levels satisfactorily, the next step will be to move on to medications. So there's various medications that we do use. Some are tablets, and some we now have medicines that are also injectables that basically inject them in similar ways to insulin. And the last one is insulin in basic health, where actually the risk is so high that you need to bring the sugar levels down because you're not adequately controlled with the lifestyle measures and also with the medications. So you need to add in insulin to help to bring it under control. And I think that's all I've got to say about diabetes. If you have any questions, do not hesitate to ask us. Okay, take care and have a good day. So I'm just going to stop sharing now. Stop recording.